Get ready for fun. Get ready for laughs. Get ready to have a great day. Live from the KHOU 11 studios, it's Great Day Houston. And now here's your host, Deborah Duncan.
Good morning, everyone, and welcome to Great Day Houston. Thank you very much. We hope you had a nice, long Thanksgiving weekend. Many of you may have indulged a little too much in all that delicious food. They say we pack in an extra 10 pounds between Halloween and New Year's. By January, when we all make those New Year's resolutions to get fit, think about this. A new study found that so-called healthy food might not be the magic formula to lose weight after all. That's because apparently food works differently in every body. In fact, one woman was eating tomatoes, a healthy food, right? Only to discover that the tomatoes were causing her blood sugar levels to spike. So what do our doctors think about this? Let's get some food for thought in our medical hot topics. On our panel today, please welcome plastic surgeon Dr. Paul Vatanis, pharmacist Sejal Upadhyaya, ear, nose, and throat specialist Dr. Kevin Smith, and heartburn and reflux specialist Dr. Elias Darido. Good morning.
Morning. Morning.
All right. Okay, so this whole thing with healthy food. A lot of us by now think we have it down, and we think, for goodness sake, if it's a vegetable for sure, or a lot of fruits, we're okay. But this woman finds out that tomatoes cause problems for her blood sugar.
I'm upset.
You what?
Because I'm upset because the day after Thanksgiving, we went to breakfast in Dallas. I ordered some steamed broccoli and a salad. So you're telling me that might not have worked for me?
Well, it might not have worked for you. That's right. Yeah. But you know, it's funny because we get all this information. We have more information today than ever before. But I think what we're doing today is, and we see this when we look at specialty hospitals and things, not everything works for everybody. We have a tendency to say, do this, one size fits all. It doesn't. The body reacts differently to different things.
Yeah, I think at the level of the intestines, when we eat, the intestines and the stomach react to food. And if you have, let's say, diabetes, or you're pre-diabetic, and you're eating tomatoes or you're eating apples, these are healthy food items. But you can't handle the sugar load with these. So you are going to have a spike in your sugar.
Yeah.
And when we do bariatric surgery, we take patients who are diabetic, and next day after surgery,
it's gone.
It's gone. So when they eat an apple next day, they are going to react to it differently than before surgery.
Their body can handle it.
And so we changed the interaction between food and the gastrointestinal system. And each one has a different gastrointestinal system function.
Right, and we're seeing things like food allergies when, different people can eat different things, and that should be an indication that we can react differently to certain foods. Now, this is the best part of this, Dr. Smith, you'll be happy to know. Adding fat to a meal, on average, reduces blood glucose response. So it is okay for us to have some fat. A few years ago, we demonized fat and said, no fat, everybody. Yeah. But we actually need fat in our diet, don't we?
And this contributed to the diabetes epidemic we suffer from now, because they took fat out and they replaced it with sugar.
Yeah, with carbs. And that's the other thing we're confused about. We look at carbs and go, but that's not sugar. It turns into sugar.
And a lot of patients, a lot of people suffer with unwanted fat that no matter what they do, they can't seem to just make it go away.
Right.
And, we tell people to be on certain diets, and they try to do those certain diets, but some people genetically have a predisposition to have more fat and carry more fat than other people. And, it may well be that part of the diet that we're focusing and telling people may not actually be helping some of these people.
Right.
Unfortunately, we just don't know yet which ones and to put on which diets, unless we start doing a lot of
fortunately, we have
testing.
plastic surgeons who can suck the fat out if we need them to, so we're good with that. All right, this next study says scientists say we're moving to a post-antibiotic era, and the reason why they're saying that is that the antibiotics are not working. And I think sometimes we forget that we look at bacteria, it's an animal. It shucks and jives, and whenever we have an answer to it, it has a response back to us. And so we have to constantly be vigilant on that. But to get to the point where antibiotics just won't work is pretty scary. But we're seeing that, aren't we?
We are. I mean, there's an epidemic that the CDC is calling one of the worst in decades, and that's the antibiotic resistance. Mm-hmm. And it can create small procedures even to not be done anymore. Something like a simple knee replacement that you have to get antibiotics for post-surgery. If the antibiotic doesn't work, that knee replacement now can lead to tragic other losses.
And they're saying the bacteria is much stronger now because of so many ways that we're getting, obviously, in our foods we have, antibiotics, and so the bacteria is able to get stronger. The other thing that is so hard is I can't tell you how many friends go, Oh, I'm calling to get the Z-Pack. I'm calling to get this. And it's when you overuse antibiotics, what happens in our body?
Well, the bacteria morphs, like you were saying. It morphs and it becomes very adept at being resistant to the antibiotic. So a lot of times, I'll see patients in my office who come in with ear pain thinking they have an ear infection or they've been told they have an ear infection that they took antibiotics for. The ears are perfectly clear and it's something related to allergy.
Right.
So it's very important for doctors to not give in to what the patients want you to do and to actually follow your heart and your education and treat people appropriately.
Yeah, they say there's
not only this, with antibiotics now, they're destroying what we call the gut microbiome.
Exactly.
All these bacteria
it
living...
kills all the good bacteria, too.
Yeah, it's good bacteria, 100 trillion bacteria living in the colon and affecting your health at so many different levels. Whether it's diabetes, whether it's allergies, whether it's your weight, your metabolism. When you take one antibiotic pill, you're wiping out millions of those bacteria.
And
it takes time.
Your immune system's working harder and harder to try and fight off things because you just basically took away part of its defense as well.
Yeah.
They said the MCR1 is becoming more common in China, and they say that they just won't be able to treat it. People, literally, they're looking at people saying, there's nothing we can do. So hopefully you can weather the storm, but more than likely you may die. So just a word of warning there. Okay, there's another research study that said losing the sense of smell could be linked to poor health. All right, the sense of smell is much more, I think, is one of those things that we think if we had to lose one of our senses, the sense of smell would be the one that we would probably lose. And then when you can't smell is when you realize, wait a minute, this is much more important than we thought it was. But what about this link to health?
It really is, because the sense of smell, it helps you engage when you eat. I mean, Thanksgiving meal wouldn't be the same unless you could smell and taste it at the same time.
Right.
Studies have shown that you can eat chocolate, but if you close off your nose, you can't even distinguish what it is you're eating.
That's blasphemy.
So it's very important. And from an ENT standpoint, the first things we look for are problems in the nose, polyps, nasal airway obstruction that cause the odors not to get up into the olfactory part of the nose where you can smell it. Once you go beyond that and those things are corrected, then you have to look at trauma to the nerve or either viruses that can attack the nerve and actually kill the nerve.
Yeah.
So those are all, the sense of smell does lead you down a course to help you diagnose problems.
Yeah, which you can look and say that it could be linked to poor health for that reason. There's something else going on. All right, we have an email from our viewer, and this email says, I have a nagging, dry cough, but I don't feel sick. What could be causing this? And Carl, we hear this a lot from people saying, the first thing they think is lung cancer. And it's like they alleviate that, and it's like, okay, well, what is this? Because it keeps happening, and a lot of times it's misdiagnosed.
From my point of view, acid reflux is the #1 cause for chronic cough like this. And this is what we call silent reflux or laryngopharyngeal reflux, and basically acid going all the way up to the larynx, irritating the vocal cords and causing this cough day on and day out. And patients think that it's coming from an infection, from an allergy, from asthma, but it's actually acid reflux, and it's silent because they don't feel the heartburn.
Right.
The typical heartburn with acid reflux, they don't feel it.
Yeah. The other thing is certain medications can make you have that dry cough, huh? All right.